Hi and welcome. I'm Dr. Manoj. I'm a plastic surgeon. The sound of firecrackers reminds me of a common problem that we face every year, that is, burns. Burns can be caused not only by fire, but by electricity, chemicals, and there's even cold burns. Burns are basically divided into superficial and deep. Superficial burn involves only the superficial areas of the skin, whereas a deep burn involves the entire thickness of the skin. What do you do if you sustain a burn? I've seen everything from honey to butter to baking soda being applied on a burn. What do you really apply, and what is the first aid for a burn? The first aid for any burn is to wash the area in running water. Never use ice cold water, honey, butter, or anything on the wound. Remove any loose clothing that is attached to the skin. If it is difficult to remove, please do not attempt to remove it forcibly because it can take away the skin with it. In small burns, that's when the area of burn is very small and superficial, once the initial first aid is given, you can apply one of the silver-based ointments. However, in all deep burns or superficial burn which involve a large area, please do seek medical attention. An important point to remember if your dress catches fire is not to run. I know it is difficult, but when you run, the flames grow stronger and higher. So, all that you have to do is stop, drop onto the ground, and roll. And that's the best way to put out that fire. Another important cause of burns is electric burn. Electricity, when you sustain an electric shock, the point of entry of the shock and the point at which the current exits your body can sustain burns. The current can even jump across joints, causing burns. Not only that, electric burns are often associated with changes in the heart rhythm. So, always in an electric burn, take medical attention. Another important group of people who we see coming with burns is the pediatric age group. The commonest cause that we see for children sustaining burns is when they pull on tablecloth where hot liquids have been placed on the table, loose cable from kettle containing hot liquids, and they pull on it. The first aid remains the same, and in children, always seek medical attention. Before I wind up, I'd like to mention three do's and don'ts in burns. Do wash the area with just tap water, running tap water. Do not apply ice, toothpaste, butter, or honey onto the burnt area. Do cover the area with a clean cloth. Do not apply tight bandages. Do seek medical attention in all burns. Do not break any blisters. See you all next week. Till then, remember what the doctor said.